We have to talk about the disproportionate impact this virus is having among Black Americans, people of color. Obviously, there are long-standing inequalities the way the medical establishment, what happens to a Black American when they go into a hospital, they are treated differently statistically than others. We've seen this for a very long period of time. Access to medical care, pre-existing conditions like diabetes, heart disease. There are a lot of inequalities in the system that an event like this bring to the fore.
Yeah, and I think taking it even a step earlier than that, I mean, the reason that blacks have so many more pre-existing conditions is because of structural inequalities as well. Access to healthcare is one thing, but living in areas where, there may be socioeconomic disadvantages, you live in food deserts, you can't get healthy foods, basic things like that make it very challenging to not develop some of these pre-existing conditions. And then, in the midst of all this, there's been inadequate testing. The testing has been even more disproportionate when it comes to blacks. And I think that when you really look at the types of jobs, blacks are much more likely to have these frontline essential sort of jobs, jobs, frankly, that are keeping the country running, transportation, food, delivery and logistics and all these types of things. But those are also jobs that are higher risk right now. So there's all these different factors that play into this. But I was, despite that, knowing that, and I've covered these types of stories, I was still sort of stunned by the numbers. I mean, cities that have a African-American population of 30%, and yet 72% of the deaths from COVID are among blacks. I mean, this is a really significant manifestation of these long-standing structural inequalities, and something's got to be done about it. Because, Anderson, we may run into a situation, hopefully not, but maybe we will, where some of these precious resources may be rationed, and I hope these structural inequalities don't persist into that rationing as well, Anderson.
Yeah, Sanjay, stay with us. I want to bring Jim Acosta to the White House and CNN's chief political analyst, Gloria Borger. Gloria, the president continues to say things are untrue, saying things that are untrue at the podium day after day. He clearly is now focusing on the World Health Organization, and that's something he's sort of taking the lead from a lot of media folks in conservative media and other politicians.
He is, and from Republican politicians, as you pointed out earlier. This is a president, as we all know by now, and we should be used to it, who likes to distract. And what he is doing now is trying to rewrite history as we are living it. And in finding a new enemy in the WHO, it's quite convenient for him. And let me point out, the WHO has not been perfect here. But he can say, aha, they are the tools of the Chinese, which is, of course, another convenient and popular enemy, and they are in cahoots, as he put it, and therefore he was not getting great information, and that's a way of also saying, well, while I was giving you bad information, it really wasn't my fault. I mean, today, Anderson, he called himself a cheerleader. And he keeps saying that, and I couldn't help but think, real leaders aren't cheerleaders. Real leaders tell the country the truth. And that is not what the president was doing, and now he has a way to blame it on the World Health Organization.
Yeah, I mean, cheerleaders aren't calling plays. Coaches do that, and that's sort of what you want somebody doing in a situation like that. I mean, there is a role for cheerleaders, and it's great to have them in the game and making people feel good. But when you want actually stuff done, you need coaches and you need players. You need people fighting this, which we have plenty of that. Jim, these memos from Peter Navarro, one in late January, warning the White House about coronavirus, saying it could evolve into a, quote, full-blown pandemic. I just want to play what the president said today when he was asked if he saw those memos. Let's listen.
I didn't see him, but I heard he wrote some memos talking about pandemic. I didn't see him. I didn't look for him either. But that was about the same time as I felt that we should do it. That was about the same time that I closed it down.